I do want you to address the question of public transport. Can you imagine, as we try to move back to what may be the new normal, hundreds of clubs and children travelling on public transport, whether it's Dublin Bus or Bus Éireann, on short or long journeys, without proper protection? And here I think that the government is being utterly hypocritical, because there's lots of talk of masking, that it should be used, that it's advisable. We heard from the WHO this morning that it's a perfectly reasonable suggestion that masking should be mandatory on public transport. But of course, making it mandatory would put an onus on the state to provide masks. And we're all familiar with the scenes we saw at transport hubs in Madrid, in cities in Italy, in places across Austria and Germany, where the state actually stand there providing masks to passengers as they move in and out of public transport. And that is what has to be done here. And I just want to use the example of Bus Éireann, and I've spoken to you about this before. The protocols for return to work were issued on the 9th of May. That's 33 days ago. And it was only last week that the Health and Safety Council of Bus Éireann finally had a Zoom meeting of all their national representatives to discuss what can be done. And what can be done has not been done, and they've wasted 33 days in making preparations for a return to something of normality. Now, I think you know and I know that eventually we're going to have to give more capacity on the buses, and that key to this is masking, but key to it is also protecting the drivers. There have been 35 drivers sent home with symptoms in Broadstone Depot alone. And we know the stats of deaths in London and New York, much bigger cities, I admit, but the stats of the deaths among bus drivers are very, very high. 42 in London, 120 in New York. And for the sake of both passengers and the workers on those buses, we need to do much, much more. And I believe that your role in intervening with the National Transport Authority is crucial here, because Bus Éireann drivers have been driving around the country without protective screening, without adequate protective screening. And we heard recently from Professor Kingston Mills of Trinity that what's actually required on public transport is proper air filtering, a system known as HEPA, high efficiency particulate air filters, that will actually trap the virus. The systems we have on our buses are totally inadequate, and on buses like Bus Éireann, 70% of the fleet don't have windows that passengers can open. So air is circulating that could actually be circulating the virus. This is an extremely dangerous situation and has to be looked at with a certain urgency. Apart from all of the other issues to do with the lack of health and safety on our buses, I think that you need to address, and your government, your cabinet, need to address the question of resourcing masks, of the capacity of giving public transport hubs an issuing of masks so that we can actually protect people as they move towards returning to work